thank you very much for the opening remarks. I think the key theme of this presentation is not only about patient-centricity and why that matters, but really how can companies actually operate within this space and what sort of novel strategies, novel way of thinking is out there in terms of making sure that companies sort of align to this bigger theme of patient centricity, and what does that mean for things like operating margins, profit, gathering revenue, and so on. And the nice thing is that these things are all aligned as long as the system as a whole is in line with these aims in mind. And that not only means that we have products coming into market that are patient-centric, but also that payers and regulators recognize this to make sure that the innovation that's applied onto any new medicines are actually recognized and reimbursed. I'd just like to start with some of the key fundamental drivers, I guess, that are starting to worry a lot of generic companies out there. And I say specifically generic companies because on the left-hand side of this chart, we have the volume growth over the last few years, and it's been decelerating. So we're not in a negative volume growth space, but we've definitely seen a deceleration in the amount of medicines consumed. And there is multifactorial. It goes into predominantly things like countries coming off periods of recession, implementing policies to limit the use of medicines. Antibiotics is a big one that usually adds a lot to volume. So decreasing use of antibiotics, is that we're seeing worldwide, is pushing this down a little bit. And what's really worrying for a lot of companies out there is that not only volume is decreasing for developed markets, that's that blue line across the bottom, but actually deceleration is happening for these far emerging, so the emerging economies, Brazil, Russia, India, China, Turkey, Mexico, and a whole host of other smaller but sort of high growth countries. We see that volume is decelerating in those also. Now, when a company, typically a generic company, will be looking for extra growth, it would go through to new markets, new geographies, potentially getting new molecules out there in order to find growth. When you find a period of deceleration, it starts to struggle in terms of sourcing new growth from volume alone. Therefore, it starts to looking at pricing, right? So there's the two levers there. However, this is the US picture where the distributors have consolidated, and now the buying power is such that about 90% of medicines in the US are purchased by three groups. The US is typically where generics companies get a lot of their revenue from when they invest into making a new small molecule. That's sort of their break-even market, and then they will try and grow into periphery markets to actually gain any sort of extra profit on that. The major market, the US, where typically they get a lot of the money, now has such a strong amount of buying power that many companies, especially a lot of the Asian ones, are finding it very difficult to get the price they need for their molecules. So we're in a situation where a company is facing pricing pressures, specifically in the US. It's got squeezed margins because not only is it facing sort of pricing pressures, but also the volume level is going down. So the margins are getting slimmer and slimmer. There's also been a lot of overcrowding. When you count out the number of companies that are actually operating, in fact, market by market globally, and I'll take the US as an example, over the last 5 years, we've seen an acceleration in the number of companies that are actually operating within the US. So it's creating a lot of competition, it's creating a lot of overcrowding. And one of the fallouts from that is that processes start to become a little bit more optimized. I wouldn't like to say that corners are cut, but essentially, different sourcing strategies, trying to push products that are a lot cheaper through to market. That starts to hit some of the quality issues that we've seen. So the FDA is getting a lot more stricter on this. We've seen Europe becoming a lot more stricter on this, especially turning its eyes on the East. So there is an element of increased compliance in which these companies have to operate in. this now adds an extra level of regulatory burden, compliance burden. And so what we typically will probably find is that a lot of companies that were operating in the US on small margins are going to start pulling out and focusing on other markets, typically some of the sort of more emerging type countries. So what can companies do? And this is predominantly a generic strategy here, is, well, they can go to sort of down a portfolio rationalization route. And this is sort of the typical strategies near the top, so new geographies as well, so operate in different countries. And then it starts to become more of a value play. So rather than this sort of tactical and strategical play, companies, and I see this a lot more as well, and Asian companies included, is where can we actually play in the value space? Now that could be complex or specialty generics, biosimilars. Now I think a lot of companies that are not in the biologic space are not necessarily looking to go into the biologic space now, but there are many services that go around the biosimilars or an increase in biologics usage as a whole that they're starting to tap into alongside that. But the key story of today is going to be about value-added medicines. Now, value-added medicines, as defined by Medicines for Europe, are medicines that take an off-patent molecule and you innovate around it. So you potentially take something, you combine it, or you reformulate it. But at the end of this exercise, what you want is something that is potentially better for the patient. Okay, so we have the patient-centricity there in mind, and in the hope that if it's going to get adopted by the patient, then it's going to have knock-on effects by physicians, knock-on effects onto payers and regulators, that they will actually start seeing this as a valuable innovation. So these are just some of the benefits that we identified from value-added medicines. One is you can actually increase efficacy. This is a much harder one to do, but for example, Abraxane is the key example there, where you take an old molecule, paclitaxel, and start to bind it with the actual delivery mechanism in order for it to get into the right areas in the body a lot better. You can reduce the side effects of medicine, and that's a very good one. Here we have Targan, which is when patients take opioids, you can actually combine it with a stool softener as well, so they don't get constipation. Additional therapeutic options, so this goes to line extensions and so on. And then the one that actually most interests me at the moment, and I think has the most untapped potential, is the improved patient experience. So this can be making sure that you add on something that is actually, that the patient can now feel, touch, hold, another modality. And that could be a device, or it could be the way that they use it. It's typically the first time when companies start looking at patient experience, it's typically the first time where a company starts to hire product designers, UI, UX, start getting focus groups with patients. Please have a look at my device, feel it, touch it. Do you like it? Does it smell funny? Is the color okay? Is it the right size for your daily life? We know that the largest market now for these types of devices are in diabetes, and you can imagine a patient who has to have several devices on them daily. It's just going to be a game changer if you can, shrink the device down by 3 times as much, or integrate it with some of their wearables and smart devices. This is IQVIA's view on the market size currently of value-added medicines, and there's a few caveats to this. One is this is based off the MIDAS database that we have, coupled with a database that we have in the US as well. We don't count any devices, device sales, any digital therapeutics, any follow-on services on this, just because we audit packs sold as medicines. So typically what we have here are things that are sold in a pack, goes through our normal auditing process. It could be things like reformulated products, combinations, and then those that have a protection, not on the patent of the molecule itself, but on the device. So we are able to capture that. So anything that has a device with it, but not necessarily the sale or the value of that device. So The market size as it stands is between 40 and 45 billion, about 43 billion. Now, that's the size of the total pharmaceutical spending here in France. So it's not an insignificant number that we have here as a total market size. What we see first is that the growth has been declining over the last few years, but that's a typical reflection of the majority of the market. That 70% actually comes from the US, where EpiPen has had some price reductions. Some generics are coming in as well. Braxane has dropped its price recently, and that means that it's actually distorting the market from a US-centric point of view. And the US is so big, particularly because it has the regulatory pathway 505(b)(2), that all these products sort of seem to fall under quite neatly. We don't have that pathway here in Europe. We are, as part of Medicines for Europe, trying to make sure that we get similar regulatory allowances like they do in the US. So I do encourage anyone who's sort of interested in value-added medicines and what it means for their company to actually take a look at what Medicines for Europe are doing, because they're trying to engage the regulatory ministers and payers to make sure that they get some sort of allowance here in Europe as they do in the US. Now, on the far side is we have a bubble chart. This line diagonally means that anything below it has grown less in the last year compared to the last 5 years. Okay? Anything above it means that in the last year it's grown faster compared to the last 5 years. So it's really quite a crude measure of growth and acceleration here. The price of some of the products I mentioned earlier, and the US has been putting a little bit of pressure on a price perspective. That's dropped the US down a little bit. EU sits roughly, it's not changed too much. It's on that diagonal line. But I think the key interesting point here is that the emerging economies have shown an increase in growth, and that's typically due to the fact that a lot of these countries, these emerging countries, don't necessarily have the right medicines as the standard of care that patients actually need. So they are much more willing to go and pay out-of-pocket expenses for a drug or a type of medicine that actually suits them a lot better. So we're seeing an interesting amount of uptake in there in terms of value-added medicines, combinations as well. I think in China we see that medicines that are to treat oncology, China now, the incidence of oncology, the treatment of oncology increasing so much that some of the chemos are being combined with medicines to sort of anti-nauseating agents or any of these conjugates, for example. That's actually doing really well in areas like China. We see as a whole things like women's health and fertility options. They do really well in areas like Latin America and in Asia as well, where women can actually go out and purchase that medicine out of pocket. And that's sort of very empowering as well, right? So it's really valuable to women in these areas. When taking a look at a therapy area perspective, like I mentioned before, oncology really is the only specialty therapy area there currently. The problem with specialty medicines within value-added medicines is that you're not convincing the patient so much as you're trying to convince the physician or you're trying to convince the payer that what you have going through a hospital is worth it. So it tends to be retail medicines that we see for these type of therapies. So oncology really driven there by Braxane, I want to point out, and some of the medicines that we see in China. So pain therapies are the biggest, right there in the middle. Slightly decreasing, but that's a US phenomenon as well. It's been used, so value-added medicines is key to the fight against opioid abuse. So making sure that we have different alternatives to just plain opioid pills. So pain has been very successful in that. But even then, so the abuse deterrent options are very big, but even then, pain as a whole, sort of the opioid medications, there's been a decrease in prescribing as a whole. Respiratory is also a large one, and that's to do with just because we have a device that we can play around with. But I think the interesting ones actually are the ones that we see sort of like CNS, nervous system, ADHD. And this is the start to play on the CNS regions or mental health, where I think there's quite clearly a lack of good treatments available, especially in less developed markets, where the patient may not be able to actually take their medicine, potentially because they don't even want to take the medicine. So some of these, the value-added medicines that we see typically go from extended formulation in the CNS and mental health field, where patients don't have to take 3 pills a day. They may be taking 1 pill a day or 1 pill a week or an injection every month. And that's really sort of helping that along. A lot more can be done in that. And interestingly, that's where we start seeing the first sort of digital therapeutics technologies out there. They are trying to treat sort of the mental health side of things when it's an app only. Digital or connected devices start to become anything that has a device in play already. So diabetes was a big one, respiratory is another one. And then there are other types of connected devices that may be suitable for other therapy areas, including oncology in terms of tracking, making sure that you're taking your medicines at the right time. Sometimes we see that patients are taking such a large cocktail of mixtures that sort of changes week on week due to the stage they're at within their therapy, that actually they need something to let them know what they should be taking and when. When we break down our data set, we see that nearly half of all these medicines are oral. That's not necessarily surprising, but here a good fifth of them are injectables. This parenteral slice of the pie here. And that's actually the fastest growing. We see that growing at about 14% over the last 5 years in value. So within the oral segment, nearly that's about a third is actually long-acting. So a lot of that is within the CNS, like I said. That would sort of sit there. We have combination when you take a look at a volume perspective. So this isn't sales in the middle. This is now just volume. A good quarter of the medicines out there are actually combinations. And sort of these are existing technologies that we see. But what we start seeing coming through are really the injectables here. And that's really a key theme across markets as a whole. Biologics increasing in not only the number of approved biologics, but also sales are becoming a lot more important. Injectables are becoming a much bigger thing. Pre-filled syringes, they've grown 24% within value-added medicines. Infusions, 9%. Vials, 11%. All these sit within injectables. Take into account orals, they've not grown in the last, at least coated tabs, not grown in the last 5 years within value-added medicines. Capsules have, sort of liquids have, so liquids may be more combinations. Topical, some have decreased a little bit. I think topical formulations, a lot of that was within the pain therapy area. But when you take a look at how a company evolves through its value-added medicine profile, we can think of value-added medicines as a spectrum of innovation. On the left-hand side, we have things like combinations, formulations, putting things into dermal patches. And we're talking about existing technologies here that companies take from their portfolio lineup and they say, okay, what's really easy that I can do with what I have already? Okay, so typically that's what's happening now in areas in Asia, for example. So I was in India a few months ago, and there's a wide range of companies there, all at different stages of this. But the companies that I went to visit that are typically in the generic space, they're saying, okay, look, I have these generics. I specialize maybe in oncology or maybe in respiratory. What can I do that sort of puts me on this map? Well, first is, can you actually find a combination, a reformulation? Yes, I can. It's going to take maybe another $500,000 of investment to get to that stage. But I think I can probably do that. Or can I partner with someone else to actually put it into a dermal patch? Yeah, potentially that might cost another $1 million to get out this enhanced molecule and put it through the 505(b)(2) pathway, because that's what they're thinking first, is it needs to go through the US. Some companies, though, already are starting to play within this part. So they already have this value-added medicines portfolio or 505(b)(2) portfolio. And they're starting to say, well, this is actually becoming a little bit more crowded because all my neighbors are trying to operate here. How do I get more into the inhalers and auto-injectors, also the diabetics, anything that has a device? Well, the first thing, obviously, that they now have to start thinking about is the patient in mind, really looking, touching, and feeling the device, like I mentioned earlier. Next is you have to partner sometimes. You're not going to go out and build your device by yourself. So it's about taking a look at partnerships and what's actually out there. A lot of companies that are building devices are also looking to partner with some of these guys here. But it's hard to build a device that has everything in mind. And I'll go on to that in a minute. And then further on down the line, this is really where medtech lies. So this is sort of everything that's really expensive, that's really novel, and quite niche so far. You know, your microchips and your implants that might be a mini pump and so on. And that's sort of the higher end of the innovation. But I think value-added medicines really sits within these two boxes, and that's where we see the majority of companies now. The next layer, and I think this is where it's getting really interesting, is this digital layer. And only really companies like Mylan and Sandoz have really started operating in this layer currently. But we're starting to see a lot more, I guess, startups that have technologies, and all they're doing is they're trying to wait for the right company to partner with. The good thing about digital, I think, is that, you know, when we talk about digital, it's quite a broad sense of the term. So really it can slot in wherever you are already operating in, whether it's on one side optimizing processes or actually what we'd like to speak about now, which is creating value. So using digital to actually start creating value. And different ways can be done to do that. Integration with smart devices is a very good one if you don't have your own devices to play around with, or you're not going to be able to partner, you don't have that opportunity, is to take a look, well, what apps are out there, or what sort of smartphone devices, what chips and sensors are Apple and Samsung putting into their, an FDA grade chips and sensors into their into mass consumer devices that I could actually start tapping into. So a few companies have already started forming little focus groups to say, well, that's a good point. What's actually out there, I don't want to be the one missing out on, because if we're going to get an app or a device that starts to tell you it starts to control maybe your hypertension, and starts to tell you what you should be taking and when. And we're talking about hypertension here, it's a medicine that's very old, not much value-added medicine strategies could work on hypertension potentially, but tracking things like blood pressure and so on, or having an app that actually starts to modify your treatment patterns a little bit, it's going to work for generic companies as well as it's going to work for these digital developers. So they're starting to form focus groups just to scan what's out there and to say, okay, these are actually of potential interest to us and it fits within our portfolio. Interconnected medical devices. So the interesting thing from medical devices is that because they all operate in own different silos, they don't necessarily speak to each other. So you create a device, but it doesn't necessarily speak to another device the patient is wearing. And currently there's a bit of discussion as to whether we're going to get like an open source framework where, okay, let's have a sort of like a consortium and say, let's share some of this data that's sort of that we are able to, so that we can move things along quicker. There's plenty of people in the industry, though, who say, well, no one's going to share their IP, and cynically, potentially, maybe no one will share their IP, because we've not seen that much in other industries either, except maybe for things like, Tesla sharing all its IP on electric vehicles because it wants to move the whole thing forward. So it can be done. But wouldn't it be fantastic if you have one device from one manufacturer, maybe telling your smartphone, his glucose count is getting low, so that device then tells another one, or start dialing up, or start dialing down maybe insulin. And having this interconnectivity will create this sort of ecosystem that's actually going to be very healthy for the patient as a whole. at the moment, everything is siloed. So we have patients that are saying, well, I have this device, but actually it's going to cost so much more to get this device that actually works with it that it's not worth it for me. So I have sort of a dumb smart reader or smartwatch or smart diabetics device. So that's currently where we are at the moment. So it still needs a little bit of sophistication in there. Digital therapeutics is very interesting, and like I said before, it's right now using it a lot in studies to help mental health, addiction behavior. Telehealth is another big one as well. But so far, results are mixed, but it's a very nascent technology. So I think, definitely one that we should be taking a look at, especially as a generics manufacturer, is taking a look to see how my portfolio of medicines can fit in with these technologies. And typically, this is the digital roadmap of a company. First is that they need to have some form of data capture, whether that's building your own device or piggybacking on someone else's device, is making sure that you have sensors of connectivity, you start gathering the data points to track how the patient uses your medicine. Then it's about sorting that data, making sure that it's in one one very, should I say, clean format, easy to use, single source database where you have structured the data ready to actually be useful for algorithms. And I say this as companies have a lot of data right now that they don't know what to do with it. There's a lot of money being made by companies like Accenture in sorting out all that data that's happening so that it can actually be used in a meaningful way. But once you actually have all this patient usage data, you're actually able to start communicating value to regulators and to payers. Because one of the key issues that we have is that payers are saying, well, look, that's great that you've created an interconnected device, but why will I have to pay an extra 20% for your device? Well, could you now start communicating some of that value back? And I think that's the key thing, is to start saying, well, look, I've tracked how patients have used my devices in the past. We've got all this data here that shows, look, actually you started to see a much greater uptake of usage because of it, and therefore it could be that the patient isn't wasting your resources in other areas like hospitals and so on. So, we can go into debates about the whole siloing of the drugs budget versus hospital budget and how they don't speak to each other and how that needs to be reformed. And that debate is happening. Again, Medicines for Europe are trying to push that on the policy side of things. The great thing is that you can start learning patient behavior, right? If you're going to communicate that value, you can start seeing how they use the medicine. When do they skip taking their pills? Is it in the morning? Is it in the afternoon? In the evening? To add the next layer, and I would argue that maybe no one is actually doing this properly yet. Maybe one or two companies. I think Abbott potentially is in the gamification space currently, and that sort of build incentive mechanisms. So actually start to incentivize the patient to start using your product better for a better use of their therapy, of their medicine as a whole. You could have network effects. So gamification typically are things like notifications, right? Ranking people against each other, points or credit. These are all things that were invented by the betting industry, the gaming industry. Many years ago, slot machines came first, and then the sort of games picked up on that. And they're very good at getting you very addicted to those games, as we all know. So it's about using similar tactics, but to make sure that we actually, align it with better patient behavior. And it's a very nuanced area here. I think we can do it properly, but we have to make sure that we're also using the right terminology. So we don't want to use words like manipulate, but we do want to use words like support, right? And so we see that potentially we have, and if this is elderly patients as well, they would actually be a key target of using a lot of these technologies all in one. But you might have prevention as a first step, so have sort of these wearables that are actually a bit more of a lifestyle technology. Packaging, and these are where a lot of you guys step into here, is having something that's actually very patient-friendly, patient-centric. I would argue as well that packaging companies are starting to move into the value-added medicine space. I've seen blister packaging companies create mini sort of aspirate inhalers purely because it's the same technology. They can still sort of stamp it in I'm not sure, I think it's probably vacuum form it. They can vacuum form a single-use inhaler so that kids can carry in them while they're playing sports and when they need it, or people, when they're at social events, can just slip one in their pocket rather than having to carry a large inhaler. So there's a lot of things that can be done by packaging companies within this space, and it's not just about packaging. It's seeing how can you use the technologies or what you already know in order to make that patient's life a little bit better. So it's about trying to reframe the thing, I'm a packaging company, from, at what point does the patient need support, and where does our technologies or our expertise slot into that? So it's a little bit about reframing ourselves there. Then it's about sort of administration, having big devices that are easy for the elderly to use, potentially at home, things that control some shaking as well, anything along that side of things. And then about sort of monitoring the patient, so telehealth, again, wearables, sensors, things that send notifications to the caregiver, the physician or family as well. What happens when a patient falls down? What happens if they're having a fit? Can you start automatically sending notifications if someone's having an epileptic episode to the relevant caregiver? And then behavioral nudges. Can we start to actually improve behavior so that they don't relapse, so that the condition doesn't get worse over time, or at least start slowing that down? So that's really about the gamification side. And you can have a digital component across all of these effects, or all of these modes of a patient. The connected devices, I talked a little bit about some of the problems that we have here. And this isn't just, I guess, connected devices, but digitalization as a whole, is that we have a lack of standardization right now. Every company's following their own IP routes. It needs, it either needs something like the European Commission to say, okay, we're going to follow certain standards. And these standards are being built, but it's very slow, so it needs a little bit of a kickstart. Proprietary ecosystems as well. So if you have one device, it will only work with certain applications or other devices. So it needs to make sure that we have some sort of interconnectivity, because as a whole, it's going to help the area by having increased connectivity and increased network effects. Maintaining trust. That's another thing as well, is companies don't like sharing the data purely because if that data goes awry and it's misused, then it's going to be on them. So it's about just trying to understand who's actually who's custodian for that data? Is it, I believe it should be a mixture of the patient, physician themselves. So how do we build that within the current technology systems that we have? Who will pay? Will that be regulators, or will that be hospitals, or will that be the patients themselves? So that's another big question mark out there. Data security as well. I think maybe data security is an issue that we've seen with huge companies that really shouldn't be having these issues. So can medical companies start doing this better? And really the last one's about attracting talent. When grads come out of university, they don't necessarily want to go into, I'm talking about data scientists and computer scientists, we found that they don't necessarily want to go to GSK or Pfizer. They want to go to Google and Netflix and so on. So how do we actually start tapping into that wealth of talent? Well, the key thing that's happening right now is saying, well, we're not even going to try, right? And there's been huge companies who have invested a ton of money into creating big digital divisions, and they've struggled in attracting and retaining talent. So for a smaller company, the best thing to do is to partner. And this is my last slide now. Appreciate I'm just running out of time. So it's to do with the sort of sources of value. At first, we have reformulations and combinations, and that's something that we can do already with our current portfolio, for example. Administration and devices, that's something that we now start to need to partner with device manufacturers. Data capture and analytics, can we start putting sensors into this and start understanding how our patient behaves, evidence generation and gamification. Can we start supporting this patient behavior? Can we take a lot of what we learned and communicate it effectively with regulators and payers in able to show that our products are actually meaningful and working? And what underpins a lot of this is the partnerships and collaborations. Currently, there's when I went to India, I was talking to a lot of the generic companies out there. Some were starting to do it, and others were completely clueless on how to start it. Take a look at even your local tech hub. So for them, it might have been Mumbai, it might have been in Bangalore, or in areas of Delhi, and saying, what's actually coming out there that's going to be helpful for you, and can you start communicating with these guys? Because when I talk to tech startups, they have this technology and they say, well, where can I use it? This does seem like it's going to be very good, but I also don't quite understand where I'm going to be able to use it. Therefore, we get to a stage where we're starting to advise companies, start forming focus groups, do some horizon scanning for startups and medical device companies out there, and see if you can start collaborating with them. And if you want any more information on the methodology, on some of the stats that I've shown, it's all on the white paper you can download. Thank you very much.
Thank you very much.
Thank you.
Thank you for your very nice slides. You see there is a lot of information. Do you have one question for Aurelio? Yes. It is possible to... Yes, thank you.
Thank you very much for the insights. On your last slides, you spoke about investments that, for instance, packaging companies can do to start moving into value-added medicines. And there, of course, when we look at the data and algorithms which are required for that, we see very large players, such as Alphabet, who acquired Fitbit, or who has DeepMind and has the entire data and algorithms. So what can mid-size healthcare company really do? Where should they really invest, taking into account there are huge scaled players which have much better talent and unlimited firepower?
Yeah, that's a very good question. So the question was about when you take a look at the landscape, a lot of the very promising new startups are actually being snapped up by the large either tech companies or large pharma companies out there. And that's not going to slow down, I would say. If anything, we are potentially heading into a situation where the best technology or biggest algorithm or best source of data will end up winning out. So it's, when we speak to companies about this, one of the key things that we say is, even though, you can't compete with the likes of Alphabet or Google, not in terms of trying to get the right talent, in terms of trying to attract the right technologies there, but they have also suffered in not having the right information on how to actually go enter the healthcare market properly. They also suffer a problem of attracting and retaining the right talent within healthcare. Their market access is really bad. They don't understand the regulatory environment. They don't understand payers either. And this is something that they've struggled with over the last few years. They are going to get better at it, but I would say as a mid-sized packaging and generics company, one of the key bits of information is about this collaboration. So they are going to need certain data sources from companies. Generic companies are a great source of that. They're going to need some material. So if they're going to be building a device, they're going to try to use a certain molecule for that. Generics company can help alongside that. They are going to be creating maybe a technology that is one size fits all, but it's not necessarily best for certain patient populations. And there's a perfect niche area where small to mid-sized companies can also operate in. So it's about just trying to understand exactly where to actually, put your technology to play the best. And it's really a case-by-case basis. But we haven't seen a lot of small companies saying, oh, I can't even operate within this because Google's going to overtake everything. It's just a completely different play. There are definitely areas where companies can still operate in comfortably.
Thank you very much.